And this is why I'm here today, to share my story so you are able to understand and see a patient's point of view and what millions of us are dealing with throughout the United States right now. Here's the last story I'm going to share. I actually wrote it for the Mighty on how it felt being forced tapered in 2017. I don't know if you guys want to see that. So me playing field hockey, and then that was when I was 16 in the 2-coach race. And then this was kind of like the timeline of everything. Okay, so I wrote this in the Mighty, and it was in 2017. Again, I was being forced tapered. I did not agree to this. And mind you, my doctor was always kind. We had a really good relationship. I was with her for 5 to 7 years. So I was in shock when I started being treated this way. And I think many patients were, because it was just like, it was just so sudden. It's that time of the month again. I'm headed to my pain management doctor, more like my PO or parole officer, for a monthly checkup and prescription refill. It's the same every month. I sit in an overcrowded office for over an hour after my actual appointment time. I'm called back by the nurse to a room where I'm asked to leave all my belongings. I'm given a cup with my name, date of birth, and date on it to pee in. I go into the bathroom, clean down there with a sanitary wipe, open the cup, start peeing, catch the pee in the cup, sometimes actually pee on my hand, gross, right? Close it up, wipe myself, and place the cup within the little box in the wall. I open the bathroom door to let the nurse know I'm finished. She comes in to look everything over, flushes the toilet, and lets me know I can wash my hands. I've never been arrested or gone to jail, but I certainly feel like I have now. It's like I'm visiting my parole officer monthly instead of my doctor. I go back to the room where the nurse originally had me leave all my belongings, and now I wait. The doctor comes in. She no longer makes eye contact with me. She goes straight to her computer and asks, how have I been, if there's any new symptoms or health issues since I last visited. I tell her my quality of life is slowly going down the drain since she started forced tapering me off of pain meds. I must have struck a nerve because she finally looks at me in the eyes and states it's not her fault and that her hands are tied due to CDC guidelines and there's nothing she can do about it. I think about letting her know I'm in on her little secret. No one is forcing doctors to taper their patients living with rare and painful diseases. Doctors have bought into the fear of addiction. Media, the US government, the DEA, and the Centers for the CDC has sold us all on. Instead, I smile and shake my head yes. Yes, I know. She's afraid that the DEA will charge in her office, take all of her patient files, and threaten jail time. Yes, I know. She's afraid to lose her career she's worked so hard for. And yes, I know that she is no longer my doctor. The government now controls what medications I receive, how much I receive, and how often I receive it. My doctor stares at her computer monitor and asks me again, do I have any new symptoms or health issues? I tell her it takes me longer to get going in the mornings. One of my major health issues is CRPS. My upper body, my arms, hands. My hands swell 3 times their normal size in the mornings. I let her know that my neck pain is getting harder to keep under control. She tells me that my pain levels as she tapers me down off of the medication, she tells me that my pain levels will go up, but once I get used to it, and completely tapered, my body will adjust and I'll have no issues and the pain should go down. She must be kidding. I understand withdrawal. I've tapered myself several times off pain medication when preparing for ketamine infusions. My pain always did go up as I tapered, but it definitely did not go down or go away after my body adjusted to no pain meds in my system. Maybe she doesn't believe the several diagnoses is accompanied with pain. Maybe she doesn't believe I'm actually in that much pain. She lets me know that I should prepare myself with the reality that she will completely taper me off all pain meds in the next few months. I don't say anything. I fight with myself on how to respond. I'd love to give her a piece of my mind, but I know that will do nothing except give her a reason to dismiss me as her patient, neatly giving me a one-way ticket out of the little care I still receive, and probably red flag for life on my medical records. I decide to be the good and docile patient. I ask her if there's any other medications or alternative therapies I can try. She smiles a little. She starts going through the different groups of medications I could try. Nerve pain meds, that's really an anti-seizure med, different antidepressants used for pain, blocks I could get in my neck, ketamine infusions, NSAIDs. I stopped listening at that point. It's 2017, and I've tried what she's suggesting at some point in my 25-year career as a patient. I let her know I'll research everything she suggested, and next month we can go over the new options. She hands me my prescription and leaves with a, "Have a great day." I leave my appointment feeling helpless, hopeless, and scared. How is it that as a United States citizen, I am now treated as a junkie, a criminal, and a drug seeker? I've always taken my medications as prescribed. I don't take illegal street drugs. I've always been a great patient, following my doctor's instructions and willing to try new medications and therapies when asked to. Living with health issues for over 25 years, I've tried most medications and alternative therapies. I've always been realistic and careful when taking my pain medications. Pain medication will never take the pain away completely. It just takes the edge off enough to sleep and function throughout the day. I've learned to use a combination of the medications, therapies, diet, and exercise in order to achieve the best quality of life. That's what works for me. Taking my away pain medication from patients living in constant and high levels of pain is just barbaric and wrong. These are some of the stories I've experienced in the last 31 years of my health issues. I literally have thousands of stories that I personally have experienced, and I could share with you on every topic that we discuss here, honestly. And surprisingly, my story is not unique at all, especially in the last 9 to 10 years. As patients, we just want to be heard. We want to have the ability to find doctors to work with us and receive proper medications and therapies just to live the best quality of life that we can have. Again, I just want to thank you so much for letting me speak here today and letting me share with you about my health issues. And if you have any questions, I'd be happy to answer them.
Thanks. I also just wanted to personally thank you for being here. I know how challenging it is to share a personal story and to be vulnerable in front of a number of physicians. And so we all really appreciate you and appreciate your story. And I know that you have definitely changed the course of a number of patients who will all see in the future so soon.